COVID-19, it was a tough in your role as a CEO of the hospital. How much weight that must have been to just navigate through that challenging time.
When the supply chain was so disrupted, even hospital supplies, we were having challenges getting bandages, we were having challenges getting different kinds of sterilization supplies. It was a headache. Again, I'm fortunate because I was part of a system, and people outside of the local level, we still had to operate with limited resources.
Being a CEO of two hospitals, what is it like running a hospital?
A little bit easier when you're part of a system. It's really a team effort. Again, it was a tough decision because there are a lot of people. I remember Supervisor Holmes at the time, Jim Holmes, he said to me, 3 generations of Holmes have been born in this hospital, and it kind of pulls on your heartstrings. And I felt it, and I resisted it for a while when we were first discussing it. We lost our son into a fentanyl overdose, an accidental fentanyl overdose. And he had the biggest heart. He had the kindest soul. He was an Eagle Scout. Just at home watching movies, I was texting with him that evening. And the next morning I get a call from my wife saying that he was dead. And you constantly think of what you could have done or should have done. And to this day, it's been almost 3 years, and there's not a day that goes by that I'm not what-ifing myself.
Mitch, thank you so much for coming on. It's
My
an
pleasure.
honor.
Thank you for having me.
For those people who don't know who you are, can you give us a little bit of your background? Where are you from? Where you grew up?
Sure. I'm a native Californian. I grew up in Southern California in the Pasadena area. And as I was graduating high school and looking for college options, my goal was to find a far less crowded area to pursue my education. And I applied to Davis and Santa Cruz and was accepted at Davis and graduated from UC Davis in '76. And then married the love of my life, who I met at Davis, and we did a little bit of junket overseas after I finished law school, and went to Saudi Arabia and spent 4 years there, and then came back, and we actually moved back to the Southern California area, but once again the congestion and the overcrowdedness was just getting to us. So when a job opened up in the Modesto area, we moved back up north, and I was working for Memorial Medical Center Modesto, and I was their general counsel and chief administrative officer. And then about probably mid-1990s, we affiliated with Sutter Health, and I took a position within their legal department covering the Central Valley operations. And then few years later, fortuitously, the CEO position at Sutter Auburn Faith opened up. And, as a lawyer, you get kind of tired of dealing with problems that other people create. And I thought, let me create my own problems. And so I applied for that position and was accepted and joined the team at Sutter Auburn Faith in late 1999 and just retired last month. So all in all, about 35 years with Sutter Health and 25 here in Auburn, and 10, which I shared responsibilities at Sutter Coast Hospital. So I was commuting between Sutter Coast and Sutter Auburn Faith. And that's up in the far northern reaches of California in Crescent City.
So, how the community of Auburn, you've been here for so long. What can you say about this community, this place? What really attracted you? I know there was an opportunity at the hospital, but as far as moving here and living here, can you tell us a little bit about what attracted you to Auburn?
Sure. Actually, my wife's sister and her husband had moved up here first. And we would come up, so they would come down to our place for holidays in Modesto, and sometimes we would come up here, and we just really loved the foothills, and we liked the vibe and the slower pace. And as I say, I was kind of looking for a little bit of a change in terms of career from the legal side of the business to more the operational side. So that's what led us here, and unfortunately, in 25 years, the growth has gotten so overwhelming. I mean, just coming here today, Paul, for this interview, and we only live right up just above Lake of the Pines. It took a good half hour, and the traffic from Dry Creek to Bell Road was bumper to bumper. And it's just, even though they've widened 49, more people have moved up here. And I know they talk about people leaving California, but they're not leaving the foothills. In fact, a
No.
lot of people from the Bay Area are moving to the foothills, which, as a realtor, you probably love. But it's just it's kind of changed the vibe. I mean, now when I'm thinking about coming into Auburn for something, I really try to combine multiple trips in one, because what used to be from our house to the hospital was about an 11-minute commute. It's now a good 20 minutes, and coming into downtown Auburn or Old Town Auburn is at least 30 minutes.
Yeah, I remember when we lived in Auburn in 2008 after Tatiana and I got married, and we traveled a lot to the Sacramento Valley to and back, and we lived right across the street from where the holiday market is,
Mhm.
with that new one,
Mhm.
Combi and 49,
Right.
off a streeter. And I
Yeah.
remember almost all the time we were driving, we never encountered traffic.
Right.
That was 2008.
Yes.
So it was what, like 16 years ago. So it really did change.
And of course, the holiday market wasn't there then. The gas station wasn't there then. CVS wasn't there then.
Yeah, yeah.
So there's just been so much uh, growth and development that it's starting to have its effect on traffic.
Yeah,
Yep.
they have to do something about that because all those lights, it's not helping 49. I don't know what if there is any kind of plan to fix this problem, but I hope that
I do
we
too.
hope that
Today, again, coming here, we live off of Brewer, which if you were on Streeter's on this side of Wolfcombe. Brewer is 2 streets above Wolfcombe. And I have to cross 49 to head down toward Auburn. I was there for 5 minutes, and the traffic coming out of Grass Valley was just nonstop. And it's at 3 o'clock or 10 to 3. You would think maybe the traffic would be going the other way, but
hmm.
it's
Yeah.
crazy.
Okay. Let's transition a little bit into the being a CEO of two hospitals. I'm a business guy. I kind of know how to run a company, how to run a business. What is it like running a hospital? I mean, I'm just imagining so many different moving parts, so many people involved, and not just people, different departments, different, I assume, government agencies and all that. Gosh, tell us a little bit about how is it running hospitals?
Well, I think it's, to be honest with you, a little bit easier when you're part of a system, because there are departments that support system-wide departments that support other departments within our hospital, and it's really a team effort. Every department has just about every department has a manager, and some have a supervisor or an assistant manager. And I always say there's no way I could have run two hospitals that are 8 hours apart, and typically I would drive, so I'd be in Auburn for 2 weeks and then go to Sutter Coast for 2 weeks, without a stellar team. And I was blessed with a stellar team at both hospitals. Um, but yeah, there's a lot of complexity in healthcare. It's probably one of the most regulated industries in the country. Um, our compliance department alone was vast. Our legal department was vast because there are just so many opportunities to take missteps, not purposely, but just take missteps. And so it was always good to have those folks kind of looking over your shoulder and making sure that everything we were doing was on the up and up, and was not violating some arcane regulation.
And from the time that you became the CEO of Auburn, Sutter Faith Auburn. What have you implemented or changed there, looking back from when you started up to when you retired?
Sure. Um, well, when I first got there, we had a skilled nursing facility, which was starting to become very difficult for acute care hospitals to operate. Um, we would call it, they were called distinct part skilled nursing facilities. They were a distinct part of an acute care hospital. But the reimbursement was such with skilled nursing, and the cost in being in an acute care hospital was typically higher. So ultimately, we wound up closing the skilled nursing facility only with the assurance that there were plenty of skilled nursing beds in the community. So closing I think it was a 10-bed unit, as I recall, and I'm harking back 25 years, so excuse me if I got the bed count one or two off, but um, we knew that there were adequate beds in the community to support the community's needs. So we closed that and we expanded the acute rehab unit. And acute rehab is a service that typically, stroke patients, people with orthopedic injuries, uh, neurological issues where they're having to oftentimes relearn functions, is a unit that supports those needs. And our unit was 6 beds at the time I got there. We expanded that to 11 beds, actually. And previously, we had 3 male beds and 3 female beds, and they were kind of all in one area. We were able to privatize that by closing the skilled nursing facility. So it's important to look around and determine what the community's needs are and how we can best serve those. And we did that. And then ultimately, about probably 6 years later, Sutter, recognizing that most acute rehab patients are either coming from a traumatic injury or a stroke, and most of that patient population is coming from down the hill, if you will, Sacramento, Roseville area. We opened the Rehab Institute in Roseville, and we closed our acute rehab unit here at Auburn. But when every door closes, another door opens, and we were able to expand our surgical unit. We do a lot of, and I say we do, I no longer work for Sutter Health and I no longer work for Sutter Auburn Faith, but it's hard to teach an old dog new tricks. They do a lot of orthopedic surgeries and a lot of GI surgeries. So it was good to be able to expand, and we were also able to privatize most of the rooms in the hospital. Previously, some of our rooms had 4 beds, and most of them had 2 beds. There were very few private rooms in the hospital, so we pretty much privatized every patient room. We have I believe we have 2 rooms on the surgical unit and 2 rooms on the medical unit that are semi-private with 2 beds. But typically we try to only put 1 patient in those beds. So it was really changing with the market. The patient's expectations are different today than they were 30 years ago. 30 years ago, many hospitals had a majority of semi-private rooms. Now most have private rooms. And so we were able to do that. Something else that actually we labored over for about 4 years before we actually made the decision, but we closed our family birth center. The demographics of this community had changed. And as the community was aging, we were seeing fewer and fewer births. And with that, we were feeling like it was difficult to provide high quality care when your nursing staff may only be touching 1 delivery every week. Because they're in shifts, so they're only working 8 hours in a day. So depending on when those births are occurring, they may not even have a delivery in the week. So we closed that with the assurance that Sutter Roseville had capacity to handle those patients. Again, it was a tough decision because there were a lot of people. I remember Supervisor Holmes at the time, Jim Holmes. He said to me, 3 generations of Holmes have been born in this hospital, and it kind of pulls on your heartstrings. And I felt it, and I resisted it for a while when we were first discussing it. but I think it was a good decision ultimately. We made a significant investment in opening an infusion center. Previously, all of our Foothill residents were having to drive down to either Roseville or Sacramento for infusion services. And many of those patients, as you know, are receiving chemotherapy. And often the ill effects of that drug don't allow them to drive home. So that involves somebody else going with them for those services. So to be able to offer that service in a beautiful infusion center here locally was really fantastic. And when we started that, we only opened 3 days a week, and within probably a year to a year and a half, we were a 7-day a week operation because there was such a uh, interest in receiving those services locally. So those are a few of the things
Mm.
that we've done. We were also one of the first hospitals in the state of California to go solar. And we put solar panels. Well, now you see them out in the parking lot in the front as well. But we put solar panels. We put a broad array on the property that we own behind the hospital, and we're able to support about 40% of our energy needs through solar.
Wow, that's a lot.
Yeah,
Yeah, that's I remember when I visited when you gave us the tour
that's right.
a few months ago. You mentioned that about same thing with Don Whitaker at Ceronics.
Right.
His
Well, funny story there. Don and I were playing tennis, and back then I used to beat him regularly. The tables have turned since then.
Oh, really?
Yeah, as he's gotten older, he's gotten better. As I've gotten older, I've gotten worse. But anyhow, we were playing tennis, and over a glass of wine after tennis, he said, "Have you ever thought about putting solar in at the hospital?" And I said, "No, I really haven't, but it's probably not something bad to consider." And so I started looking into it, and probably within a year, I had convinced the system, because there were no hospitals in our system at that time that had solar, that it made sense, particularly up here because we're above the fog. Um, in some of our campuses within the Sutter system, it probably wouldn't make sense. In fact, at Sutter Coast, we were looking at doing solar, but because of the difference in the weather conditions there, it didn't make sense there.
Mhm.
So, and a side perk of that was shaded, covered parking for our staff, because we put, in addition to putting some that were just ground based on raw land, we put them over the employee parking area, and staff really liked that. We also put in chargers. I think we were some of the first chargers in the community for electric vehicles.
Wow. So you've been in this industry um, for so long. You've seen a lot. How would you say the overall health of America is, or our community? Let's say our community is. Um, I know, like my age and younger, the only time that I would end up in a hospital is if I, had some kind of an injury, like in 2020 when, actually 2019, we were building our house. I went on the roof with
Oops.
with flip flops on, and it's a dumb decision. I took a bad step and I went down and shattered my heel bone, and I ended up at the Sutter Hospital in Auburn, and had my the scan done and all that. So what I'm saying is, we usually, whenever I went to the hospital, it was because of some kind of an injury like that.
Emergency
Yeah,
situation. Yeah.
emergency situation. But I'm 30 years is a lot of time to look back and kind of see any trends. Have you seen any trends as far as kind of like, is America, are we getting healthier as a community, as a society, or the opposite?
I wish I could say we were, and I don't know that it's anybody's fault, but when you hear the statistics that 45% of Americans are obese, um, that's very concerning, and that doesn't make for a healthy community. And part of that, I think, is just a function of societal changes. We're in our cars more. We're not riding our bikes. We're not walking as much. Our diets have changed. Um, I think that we're starting to see that shift and more focus on diet, but I don't think we're there yet. And if you look at some of the most prevalent chronic diseases in the country, diabetes, which obesity is a significant contributor to that, is very prevalent um, in our community, but in our country in general.
Do you think that it's mostly the diet part, or do you think that a lot of it has to do with the mental health as well? Because I know like people saying that people tend to eat when they're not really hungry, when they're trying to cover up some kind of a urge or some kind of an emotion that something going on mentally, and they're just eating just to kind of numb.
Yeah, good question. Honestly, I'm not a clinician, and I wouldn't presume to venture into that realm. Um, but you're absolutely right. The mental health of our community and our country is, you know, being challenged as well. And whether that's a function of, social media, being on our phones 24/7, uh, you know, uh, peer pressure, the stresses that and anxieties that creates, I don't know, but
Yeah, I definitely think that the social media, these gadgets that everyone has, sometimes I observe when families come together to eat at a restaurant. Even when we just visited Mexico with my family, we were at a restaurant, and dinner time, families come in,
right.
and it was kind of sad to see how people just a family, children, parents, and they're around the table and everyone's on their phone,
Yep.
on their iPad, and
Not talking to each
not
other.
talking to
Right.
each other. Yeah.
We had a rule at home that you don't bring your phone to the table. Um, I wasn't as rigid with respect to that in the car because sometimes, just it could be a long drive and um, people are playing games or whatever. But uh, I think it's a shame when just see that there's so little direct social interaction. And people feel very comfortable saying and doing things online through social media that would be totally inappropriate if you and I were talking to each other one on one. And sometimes I think that really leads to stress and anxiety.
Yeah, I agree. So the our Auburn community, I know that you are part of the Auburn Rotary and other supporting other foundations. Can you talk a little bit about your involvement in this community?
Sure. Yeah, I've been in the Auburn Rotary Club, well, for 24 years now.
You've been president.
I've been president, yes. And I'm on the fundraising committee for the State Theater. I was on the board, but when I took the position at Sutter Coast, I just felt like I wasn't able to give them the time that I should. And so I stepped down from that role. I just recently was asked to join the Gold Country Wildlife uh, Refuge, and I will actually be going to their first board meeting, I think, next week.
That's here in Auburn.
Yes. An impressive organization. In fact, if you get a chance to interview Sally Sue Stein, you should do so. She is just an outstanding person. She was actually the chair of the Sutter Health Board for several years as well. But she started that, and it's an impressive organization, and they do some great work for the benefit of wildlife. Um, and so I've been involved in that. I've been over the course of the 25 years on a number of different boards. I was on what was then called Peace for Families. I was the chair of their board. In fact, I was the board chair at the time that we raised the funds for the current shelter, but that's now called Stand Up Placer. I, of course, was very active in Scouts. My son was a Scout and an Eagle Scout and was Cub Master and a merit badge counselor for many of their merit badges.
It's 2024. 4 years ago, we were experiencing something that most of us have never experienced in our lives, a pandemic. Um, how did that affect, especially, the hospitals? Like, can you talk a little bit about what you had to go through and how you navigated through the the early days of pandemic and what kind of changes were implemented after that?
Sure. It kind of turned our healthcare world upside down. Um, and I think the unfortunate aspect of all of that is that many people in the communities, not just here, this is nationwide, kind of focused their ire on the hospitals, because we were requiring that they mask or we weren't allowing visitors. And I understand that. If your loved one is in the hospital and you want to visit them and we're saying you can't visit or you can only visit under these circumstances, whereas previously we essentially had an open door in the emergency room, we were not allowing visitors at all. So, you let's say you fell off your roof and did something worse than your heel, and of course your wife is very concerned, and we're saying, well, we can't have visitors in there, and people were angry. um, People were angry about the not only the mask mandates but the vax mandates. Even our staff, many of our staff didn't like the idea of having to be vaccinated or wear a mask, and it just, I think it, some respects, kind of raised everybody's level of awareness about a pandemic. I can remember about 3 years or 4 years prior to the pandemic going to a FEMA sponsored program in Alabama on basically events of mass casualty events. And one of the subjects was pandemics. And I thought to myself, oh, that's so far fetched. Kind of a waste of our time. I didn't think that anything of that nature would ever occur in my lifetime. And lo and behold, 4 years later, we're dealing with one. And, maybe our awareness is just greater now, but it just seems as if we're being tuned into more potential pandemics. Uh, you know, uh, Diseases, flus that are becoming more and more of an outbreak. And I would anticipate that as our population grows, we will see more.
Do you think that our state and our federal government had a good, proper response?
Yeah, Paul, you're getting into dangerous territory with me. Um,
You said you're an open book.
yeah. And no, I think that I honestly think that we overreacted. I think we listened to one person uh, and put way too much weight on his uh, assessment of the situation, and I think it really has set our society back. I think the damage we've done to our kids who are out of school, allowing the teachers unions to dictate, when they were going to come back to school. I think all of that was wrong, but that's my opinion.
Hmm.
One thing that's very liberating about no longer being employed is that I can share my opinion, and I'm speaking for myself, not for my employer.
Sure, sure. Yeah. We were so fortunate and blessed that our children back then, they went to a school that never shut down. They continued. Remember when school started, it was early September. We had a lot of fires during that month, and they were getting on the bus, even though they had a requirement to put on a mask. They still actually went to school, so they did not have to go through that um, process where they had to sit at home, for a whole year.
Right.
I feel really, really bad because I heard some terrible stories of for kids, it's important to have interaction with other kids,
Right.
be in school, or even when they're in school, see their teacher, with facial expressions instead of like having full mask on and stuff. So I think I kind of have to agree with you on that. The reaction was a lot of it was not a proper response to, because especially for kids.
Right.
Um, a lot of the kids in my siblings, their kids, everyone went through COVID, but it was just like a regular flu.
Right.
I definitely feel that those people who are most vulnerable and that had the comorbid, how do you say that word?
Comorbidities. Yes.
Yeah. That for them, definitely had to protect them and make sure that they were safe. Um,
So I'm just curious. Did your kids attend private schools?
yes,
Okay, that I think that's the difference. Yeah.
yeah, they're still in the school, Forest Lake.
Okay.
Yeah,
Oh yeah,
yeah. So
it's a good school.
it is, Well, yeah, I mean, the COVID-19, it was a tough. I really remember we were finishing up our house, and we were told that all the stores are gonna close up, even banks are gonna shut down. People were running to ATMs and local branches to pull out cash. We were trying to get our final orders for the finishes for our house put in because all of a sudden some of our orders were being canceled. They didn't have certain light fixtures that we ordered or appliances and stuff. So there was a lot of chaos, and I can only assume, in your role as a CEO of the hospital, how much weight that must have been to just navigate through that challenging time.
Well, and the supply chain was so disrupted. Even hospital supplies, we were having challenges getting bandages. We were having challenges getting different kinds of sterilization supplies. It was a headache. Again, I'm fortunate because I was part of a system, and people outside of the local level were dealing with a lot of that, but we still had to operate with limited resources. Um, so it was a challenge. But this community, and actually the Crescent City community both stepped up. I remember we were receiving boxes of hand sewn masks to give out to visitors or patients. Now, of course, we had our own masks that were a certain type that is required for our patients, but we were able to give those to staff. We were able to give those out to visitors, and it was just really heartwarming. Same thing with respect to food. I mean, food was being brought in and sent to staff. Our Rotary Club, I remember, came out to the hospital, and it was, just a demonstration of support, but it really made the staff feel good, because they were all dealing with the same stuff we were dealing with in their private lives, but then they were having to come to work every day and, make sure that their patients were taken care of.
Did you guys ever experience like shortage of beds, like some hospitals? I
We
remember.
did. And we actually had to convert some non ICU beds to ICU beds, and uh, uh, the state was in a mode of giving us what they called a flexible waiver, um, as long as we adhered to certain requirements. We needed more negative pressure rooms because of the respiratory issues, and so we had to take patient rooms that were not negative pressure rooms and basically improvise and make them negative pressure rooms by putting air control systems that vented to the exterior. So it was a challenge for everybody, and the team just stepped up and took care of it. Whether you're talking about the facilities people, the engineers, the nursing staff, um, they all just did an awesome job. I'm so proud of them.
Yeah, yeah. Mitch, usually when I meet someone in a leadership position, usually they are um, influenced by certain uh, values and principles that kind of help them make decisions. Are there certain values and principles, maybe some non-negotiables, that you have in your life, whether it's in your career or just in your personal life, that you live by?
Um, well, honesty and integrity, and I think actually that's one thing that attracted me to Rotary. The Rotary motto is service above self, and I think that that's what it's all about, really. Um, I remember once this. When did you come into the Auburn community?
We moved in 2020.
Okay, so this was in the probably the early 2000s. I was fairly new to my role, and I received a call one day saying we just realized that we have new colonoscopes, which are what they use for colonoscopies, and the means of sterilizing them is different than our old colonoscopes, and we haven't been adhering to the changes. And we had a meeting, kind of all hands on deck, and talked about next steps, and involved somebody within the system who's an infectious disease specialist, and talked about the risks of people who had been exposed to those colonoscopes was very, 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 very slight. But I felt that however slight it was our obligation to notify patients who happened to receive a colonoscopy after that had been used on somebody else and had not been properly sterilized. And we had to contact, I think, 750 patients. Now, obviously, you're opening yourself up to lawsuits, because even if the person was not physically injured, there's an argument for an emotional distress claim. 99% of the people were so appreciative that we contacted them, and we told them that we would be testing them periodically to make sure that they didn't contract Hep C or HIV or any other disease that could have potentially been contracted by virtue of a non fully sterilized colonoscope. And they had been sterilized, but it just wasn't to the new manufacturer's specifications. Um, and it was all about doing the right thing. And I think to myself, if that was a family member of mine, would I want to be notified? You bet.
Oh,
So,
yeah. How do you guys, excuse me, in your role as a CEO in the hospital, are there certain ways that you guys get everyone on board with the values and principles of the Sutter Hospital? Or
uh, I think Sutter as a system tries to stress values, and integrity is at the heart of those values. And we try to tie that to our mission, and the mission of the system has been to provide high quality, affordable care. And actually, we were talking earlier about kind of things that have changed in the community. When I arrived here, we had no medical office buildings, so physicians were just kind of scattered here and there in the community. And now there are 4 Sutter medical office buildings right around the hospital that house physicians. But in addition to that, the system has made an effort to open urgent care centers, and there's one right there on the corner of Education and Highway 49. And the purpose of that was to provide more affordable care to patients, so they weren't coming into the ER and using that as their primary care physician, which is a very costly setting to be receiving care. So we've tried to make a more affordable option available to the community, and it's been very successful. And it's not just here. I mean, we've done that throughout the Sacramento area and actually throughout the footprint of Sutter Health, is to try to provide more affordable options to patients. And just the number of primary care doctors. Now, there's a challenge nationwide with respect to physician shortages.
Why do you think that is?
I think fewer people are going into medicine, and I think in part that's because it's just my belief that we're not rewarding physicians as well as we used to. When you think about some of the best and the brightest, you know, getting into medical school, going through medical school, oftentimes after their residency, going into a fellowship for whatever specialty they want, the amount of years and the time uh, that they put into that, and we've kind of changed the rules. And so I think fewer and fewer are going into medicine, and I think it's unfortunate. And I think we as a country are going to have to look at that, because we can't continue with the shortages we're seeing. And it's not as bad here. Yes, we have shortages in Auburn, and I can name off several specialties that we would love to have another one right now, or another four or five internists or family practitioners. But you get into the rural communities of America, and the shortages are astounding. It's very concerning.
So is it becoming more difficult to become a physician, a doctor? Is it the path to get there? Is
No, I don't think it's so much the path to get there. I think it's the reward when you get out. And so people are doing a cost benefit analysis, as they should. I'm going to put this many years into this. I go to college, and then I go to medical school, and then I go through my residency, and then I go through my fellowship. And lo and behold, I'm 30. And, a lot of people who went to business school have already been out for, 6, 7 years, making a nice income. And I think years ago when they did that cost benefit analysis, it looked better because they were making more when they got out. But for the most part, in general, physicians are not making what they used to make in income.
Yeah, I'm seeing more and more doctors that come from foreign countries. I'm seeing
Yes.
more of them, and I don't know what the process is over there overseas to become a doctor, a physician, and what the transition here is when they come here. But even the student loans, paying for like the medical school and everything, it's hundreds and thousands of dollars.
Yes, it is.
So even, by the time you're 30, you're a physician, then you're paying the student loans off first I don't know how many years. So yeah, that's unfortunate.
It is. And, if you go back and you look at the 70s and the 80s, um, physicians made very nice incomes. Um, Now, and I have friends where husband and wife are both physicians, and they still live very kind of middle class. I mean, they're not uh, living high on the hog, and that's a difference from maybe 30 years ago,
It's
35 years ago.
it's the plastic surgeons that are doing
Yes.
well.
You know what the difference is? They're all privately paid, because plastic surgery, dermatology, those are not typically things that your insurance covers, and so they're not being negotiated down to these low rates. So people are willing to pay out of their pocket for those.
Yeah, yeah. Mitch, one of the questions I ask every guest on this podcast is to share a story from your life that had a profound impact on you, on your decision making, on just in general in your life. Is there a story that you can share?
Well, unfortunately, Paul, it's a sad story. We lost our son in 2021 to a fentanyl overdose, an accidental fentanyl overdose. And he was just okay, he was my son. He is my son. And so you're probably thinking, well, he's biased. But he was He had the biggest heart. He had the kindest soul. He was an Eagle Scout. He always suffered a little bit from anxiety. And when he was up at, he went to uh, Butte College. And when he was up there, he broke his ankle skateboarding. And this was back when hospitals were and physicians were compensated, basically rewarded for having uh, high scores in management of pain. And so, unfortunately, I think physicians and hospitals dished out the opiates a little bit more than they should have. And he got hooked on opiates. And when he came home, right when the pandemic was starting, he said, I'm hooked on opiates. And I said, well, we'll take care of that. We can, get you help for that. And, we went to a clinic that kind of specializes in that. And it was on and off for probably 4 or 5 times. And you watch your child go through withdrawals on something like that. It's horrifying. It's just so painful. And then he was off. He had been off for like 5 months. And I think I let my guard down. And one night, and I'd been texting with him, I was up at Sutter Coast. He decided to try it again. And this is in 2021, and this stuff's flooding across our border. And he was just at home watching movies. I was texting with him that evening. And the next morning, I get a call from my wife saying that he was dead. And you constantly think of what you could have done or should have done. And to this day, it's been almost 3 years, and there's not a day that goes by that I'm not what-ifing myself. It's the saboteurs in our mind that are, questioning you. So that, to me, has had a fundamental impact on my life. I am unforgiving of our administration in Washington. I think it's shameful that we're allowing people, and this has nothing to do with race, and I know that people are flooding across our border from all countries, but to allow that and allow people to be coming into this country with these kind of drugs, and I don't know what age your kids are, but this guy was a good kid, and for those drugs to have killed him just exemplifies what a risk these drugs are to our kids. And you look at 21, 22, 23, over 100,000 young people every year, and all 3 of those years have died from fentanyl overdoses. And you look at the entire Vietnam War over 11 years, and we lost 58,000. So this administration wants to focus on gun control and wants to focus on all sorts of issues that are not impacting to the positive our children, and yet we're allowing these drugs to flood into our country. I'm unforgiving.
I share that passion with you because, just recently I went to my aunt's funeral, and
Yes, you mentioned that, and I'm sorry to have heard that.
well, this was my mom's sister. She was born with Down syndrome, but she lived till 57. So she had a very strong will for life, but since after COVID, her health started going down, and she passed away. But when I was at the funeral, usually when I'm at the funeral, I kind of walk by, and I'm noticing a lot of new, like, tombstones, pictures, of the people that are already been buried, and unfortunately, so many of them are young.
Hmm.
A lot of them are kids of the people who came from the country where came from. My parents were coming here from Ukraine. We came in 1993. And the main driver, the main reason to come here was to provide a better future for
Right.
us. And yes, life was tough there. especially those who were believers. It was not easy to get a better education, so you can get a better job. So, people came here, brought their kids, had more kids here in this country, and it was a good reason. The reason was to have a better future, provide a better future for the kids. But I see that unfortunately, because of this issue that you're talking about, it's I think it's worse than a pandemic because
Absolutely.
you are right. The kids who have already left us, the kids who have already died, they're not bad kids. They're good kids. It's not like, sometimes maybe, 30 years ago, 20 years ago, when you heard somebody was addicted to some kind of drug, you had certain like, understanding of them. Maybe they got in with the
Right,
wrong
right,
crowd
right,
and they just started making bad decisions. But here, I even have some family members who had surgeries, had back issues. They got prescribed the pain medications. And then you get to a point where the doctors no longer prescribe them because you reached your limit, but now you're hooked.
right,
So what do? You
right.
go find alternatives.
And that's precisely what my son was doing. He was buying it off the street when he was up in Chico at college. Um, uh, and sadly, I got a call about 8 months ago from my director of engineering at Sutter Coast, and he said I'm calling to see if I can take a few days off, and I said, sure, you take as much time off as you need. And I said, what's up? And he said, well, this is one way I never wanted to be like you, but I got a call from my ex-wife, and my son died last night from a fentanyl overdose. This is in Tennessee, where his son was living. You know, the guy was gainfully employed as a chef. He was according to my facilities director, I have no reason to doubt him. He was a good kid, a hardworking kid, but they don't know what they're putting in their bodies these days, and oftentimes they don't even know that what they're putting in their body has fentanyl in it. It could be laced in something. It could be in cocaine. It could be in pot. It could, be in a number of different uh, vehicles.
Yeah, I mean it's so crazy because I've heard stories where police officers they're looking in the cars for weapons and they get close to something that's like somebody dropped it on the floor, and they just sniff it and boom,
Yep.
they're gone. Do you think how do we solve this?
I hope that we will. I don't know that we will solve it, but I hope that we will significantly reduce the rate at which it's flowing across our border post November.
I hope so too. Yeah. So, Mitch, now that you are retired, what's next for you?
I'm. I mentioned I'm starting a new journey on one board, and I've been asked to work with another group that I'm evaluating. And really, we're going to spend more time. We have a beach house way up on the North Coast. Spend more time there in the summer months when it's very hot here, and I'm already starting to play more pickleball, more golf, things that I never really had the time to do, or certainly not to perfect when I was working. So I'm just looking forward to more time off. Our daughter, our son's twin, actually is getting married in September, and she's getting married in Mykonos. So we're going to be going over to Greece, and then we'll be spending a little bit of time in Europe. So opportunity to travel, just enjoy life.
That's good. How old was your son?
He had just turned 28 the day before.
28. Wow.
Yeah,
Thank you so much for sharing that story. I really, really appreciate it.
sure.
Thank you so much for coming on. It was a pleasure having you on and hearing your story. Anything else you want to share?
I think we're good. Thank you for having me.
Thank you so much, Mitch.
Appreciate it.
It's an honor.